Why don't each of you just give a quick 1 minute overview of what you currently do and what you've been doing the last 10 years, just to update everyone who is not familiar with you. Dr. Hashmi, would you like to go first?
Sure. So my two areas of specialty, one is kidney disease and the other one is obesity medicine. And for both of those areas, I've been doing that now for the last couple of decades. And essentially, a lot's changed since I started in the field in both areas. But that's my pride and joy.
Okay, and Dr. Goldhamer?
True North Health is a facility that specializes in nutritional medicine, in particular medically supervised fasting. We treat a variety of people using this methodology. We're also an active research center. We've published a number of papers, and we're doing some ongoing clinical trials looking at how to do what we're doing better.
Okay, great. Thank you. And thank you both for joining us tonight. And both of your individual lectures were wonderful and very informative. So we appreciate you sharing that information with us. So I'm 60 years old. And when I was in my 20s, for whatever reason, I don't know why, I didn't have proper dental care. I skipped on flossing. I skipped on cleanings. I was kind of irresponsible. I'd eat a pint of ice cream and didn't take care of my teeth properly. And one day it turned out that I had 6 cavities, a couple of root canals, and all these problems with my teeth. And I went to good dentists and they did the best they could. But even to this day, my teeth have been affected by how I took care of them in my 20s. And I wish someone somehow had told me in my 20s everything I needed to do so I could have avoided those problems easily. A lot of us would like to not make mistakes like this. And we certainly don't want to make mistakes with things like our kidneys or our health overall. So a lot of the information we get, it's from the newspapers, it's from the news, it's from mainstream sources. And a lot of the times they're not really giving us the best information, the most accurate information, and they're putting our health in danger. And we don't want to have our first discussion on health and diet and kidneys when we have a problem. We would like to know before so we can have a chance to take I think, whatever action is appropriate. So the purpose of this conference, the purpose of this panel is to make sure that we didn't miss this, that somehow that we know exactly what the best science and research and your experience says so that we could make sure that we don't end up having a problem that's easily avoidable. So that is what we're thinking. That's why we're here. And we're hoping that your years of experience and all your hard work to find the truth is going to save a lot of pain and suffering for all of us. Okay. So to get started, Dr. Goldhamer, I think you've said that you've treated over 20,000 people with fasting. So I guess the first question is, okay, so what happened to these 20,000 people? When you fast, do you always lose weight? Does it lower your blood sugar? Does it lower your blood pressure? Does it cure other diseases? Does it all go away as soon as the fast is over? Like, what has been the result of these 20,000 plus fasts that you've done? What have you learned that you could share with us? What is all this knowledge and experience that you've gained from 20,000 plus fasts that we could learn so that we don't, we would like to get the benefit of whatever you've learned. So what have you learned?
So health is the result of healthful living, and healthful living involves diet, sleep, and exercise. So if you want to be healthy, you have to pay the price. And that means, controlling what you put in your mouth, because dietary excess leads to excess fat leads to excess visceral fat leads to inflammation leads to heart disease, cancer, diabetes, and premature death and debility. So what I've learned is that if you want to get patients healthy, they have to do those 4 basic things. They have to eat properly, they have to sleep properly, they have to get enough activity. And when dietary excess has been an issue, fasting can be a useful tool of reversing that process. As far as diet, we have specific recommendations, a whole plant food diet that's free of salt, oil, and sugar. That's a rather extreme version compared to what is generally advocated out there. But in our experience, that works really well. Exercise, we encourage people to engage in a variety of different activities rather than just necessarily one specific activity. So walking, hiking, biking, swimming, done most every day. And sleep, we think, is one of your most important activities so that you get to sleep at a consistent time, sleep long enough that you can wake spontaneously feeling refreshed. In my experience, people that control diet, sleep, and exercise maximize their health potential.
Okay, thank you. Dr. Sean, what is the correct pronunciation of your last name so I pronounce it correctly?
It's Hashmi.
Hashmi. Okay. So, Dr. Hashmi, you've been doing this. You've been giving advice. You've been dealing with real people. What have you seen happen? Has the diet, lifestyle, sleep, exercise work? Does it prevent people from getting chronic kidney disease? And so, first question is, does it prevent it when people follow this advice carefully? And when people already have it, how effective is it in reversing it?
Yeah. Before I even answer that, I'll go back to something you said earlier, which was the goal of this is really to make sure people know what to do right now. I would challenge that notion a little bit and say that the thing that we see is we can have all the information ready for people. It doesn't necessarily mean they will be following it. You can walk into a grocery store right now, and there's an entire section of beautiful, fresh fruits, vegetables, and it's all the way to the side. Now, all you have to do is, instead of walking straight in the grocery store, usually go right or go left, depending on your store, and you will hit it. The reason I point that out is oftentimes when we talk about change, we're talking about the what. But we forget to mention the most important part of change is not the what, it's the why. Why do you want to change? Why now is so important to you? And as a kidney doctor, I can tell you the number of patients that have died because of diabetes, because of high blood pressure, because of just plain weight is insane. And all of those patients, for years and years and years, I had those conversations. I was begging, I was pleading them to change. And so this is the toughest part of what we do is not so much understanding what we need to do as convincing people that they need to make that change in the right manner. So what Dr. Goldhamer mentioned, I have a nonprofit called Self Principle, Sleep, Exercise, Love, and Food. And when we look at kidney disease, the three biggest causes of kidney disease, once again, diabetes, that's the #1 cause, high blood pressure, and obesity, which kind of encompasses the whole 9 yards. Now, we know that if you focus on sleep, if you focus on movements, if you focus on gratitude, kindness, do something to get rid of the stress for yourself, and you eat a predominantly plant-based diet, you're covering 90% of what you need out there. There's autoimmune conditions. There's certain things where you have no control over. It's completely understandable. But the information that people need, especially today, it's available. I talk about ACLM, or the American College of Lifestyle Medicine. When I went through training, ACLM didn't exist. There wasn't anything as ACLM. There wasn't a group of dedicated, passionate doctors reviewing the literature, creating the literature, peer-reviewed studies that are being published right now. It was funny, when I did my panel, they were asking the question about, what is it that you would want people to know about your recommendations on a diet? And I said, what's interesting is if you'd asked me this question 10 years ago, I would say what I'm proposing is blasphemy. It's hearsay. Now, in the National Kidney Foundation's guidelines, a plant-based diet is listed. How incredible is it that on the mainstream, we know what we ought to be doing? And yet, day after day, in the inpatient side of the hospital, I see the same stuff happening. Patients who are spiraling. The 5-year risk of death on dialysis is still 50%. 1 in 5 people each year will die on dialysis. And so when we talk about this topic, it's so difficult to talk about because we're not talking about numbers. We're talking about people who have mothers, fathers, brothers, sisters who are losing them. And yet we still can't convince the public. And probably the greatest sham that was ever pulled on the public was to take the word plant-based and make it mainstream. We took a beautiful concept that amazing doctors who are working on it with the right stuff, dietitians, all sorts of health people working on it. And then we said, how do we commercialize it? How do we create packaged foods that is incredibly processed, loaded with salt, loaded with every bad thing you can imagine, but it says the word vegan or it says the word plant-based on it. And we convince people to change their diets. And that's why it's not so much the what, it's helping people to understand the why.
During Dr. Hashmi's lecture today, he said that instead of focusing so much on being right, as a person, instead of making your goal as a human being to be right all the time, focus more on being kind. Now, was this just a nice thing to say, or does this have something to do with health also? Like, is emotional health, us being kind, compassionate, empathetic, loving, a real thing? Is that just a nice thing we're just saying because it's nice? Or does this have something to do with our health also? For both of you, you can answer that.
I'll share a quick story. And Dr. Goldhamer is so respected in the field. So, he has far more experience around this. But there was a fascinating study. This was done in Rosenton, Pennsylvania. There were two groups of coal miners. Both of those groups, they came home every day. They both smoked, drank like crazy, ate the worst foods. Everything was fried and then fried again to make sure they missed like 1 square inch of it. And what was fascinating was that, they all had relatives in common, but one group kept dying of heart disease. They had heart attacks, strokes, you name it, diabetes, kidney failure. The other group, surprisingly, wasn't. And so researchers were puzzled. They looked at these both groups and they were very close in the proximity to each other. The only difference they found, and this is why it's so fascinating, the only difference they found was one group, they smoked, they drank, they ate every bad food, didn't exercise, but did everything alone. The other people, they did everything together. So even though they were doing bad stuff, they were doing it in the company of people who loved them. This has been replicated in animal studies, where there's been animal studies literally where it was done in rabbits, where rabbits were exposed to this extreme stress environment to see how they were responding. And there was one group of rabbits that kept living longer, even though they were being fed poison. And you know what the only difference was? That every day when there was a person, this little researcher who would go in and pick up the rabbits, this gentleman would pet the rabbits. That's literally the only thing that this guy was doing, was he was petting this group of rabbits, because on his shift, he felt really bad about their future. So the word kind is fascinating. One, expressing kindness to the other person can change their life. And as a healthcare provider, I can tell you, when you see a patient, you have no idea the trauma they're going through. None of it. I saw a patient who had been going from doctor to doctor, never being able to lose weight. And the underlying reason she couldn't lose weight was she was badly beaten and abused by her significant other. And the reason she ate was because that was her best friend. And number two is, when you express kindness, we know from data, very well-designed studies, not one, multiple studies that show that your own stress hormones go down, your blood pressure calms down, your heart rate calms down. So if you truly want to live longer, all you have to do is be nice to people, and they'll feel better and they'll live longer as a result of it. And in return, it will calm you down. The simple act of gratitude is one of the most underrated medical treatments out there.
Thank you.
So, I think that, stress is certainly sometimes an underrated influence on health, and constant high-grade stress clearly is associated with hormonal productions that's counterproductive to health. I think that in addition to trying to be kind and act kind, you can also work on controlling your environment and trying to put yourself into an environment that's more supportive of effective social interaction. For example, people spend a lot of time stressing out about things they have no control over, which is particularly unproductive. In other words, they'll watch the news and watch all the terrible things that happen to people throughout the world every day in living color. You can be a fully informed citizen and not spend inordinate amount of time dwelling on things you have no effect on. I think we're much better off trying to spend our emotional energies in dealing with things that we have some influence on, the people that we meet, the people we like, the people we love, and try to create an environment where we spend more time with people that are supportive rather than not supportive. And that means learning to say no and learning to, not allow guilt or other types of manipulation regulate what your behavior is going to be. So I think this is a big subject. It's complicated. I'm certainly not an expert in psychology. I would defer to people like Dr. Lyle and others that really make their living studying this. But I do think that whatever you can do to create a more health-promoting environment is likely to translate into physical as well as emotional benefits.
Thank you. Dr. Goldhamer, you've said in the past that I believe, this is what I think you've said, you can correct me, but I think you've said that intermittent fasting, having dinner at 6 o'clock, being done at 6:45, and then not eating the next morning till 10:45 is a 16-hour window, and that would be something you could do at home, and it's called intermittent fasting. You've also obviously recommend that people come to True North, where they can have your full attention and have a multi-week water-only fast, and people have said fantastic, amazing things about the benefits. Aside from those two protocols, the at-home intermittent fast or coming to your facility, are there any other fasting regimens that you would recommend on a regular basis?
Well, sure. Again, not eating 3 to 4 hours before you go to sleep, I think is just good general advice. Eating, late into the night, probably not a good idea. There is some evidence, Walter Longo and others have published data suggesting that programs like Prolon and others may have some utility to people who are trying to lose weight. And honestly, anything you do to lose fat and visceral fat oftentimes translates into some, at least short-term, benefit. So if you find that not eating late at night helps you lose weight, or having a 12 to 16 hour fasting period every day helps you not overeat, that's probably a good thing. Long-term fasting is a little bit different. And if you're going to do long-term fasting, whether you do it at a facility like True North Health or you do it at home in conjunction with your local doctor, it still has to be done properly, which means, first of all, you have to determine, are you a good candidate for that type of intervention? Not everybody is. People that are on medications, people that have specific health problems may be damaged by this type of long-term fasting unless those issues are addressed properly. So a proper history is necessary. And the next thing is, if you are a good candidate for fasting, fasting needs to be done properly. It needs to be done in a resting state. If you maintain higher levels of activity, you can put yourself and other people at risk. For example, you wouldn't be a candidate for driving an automobile while you're doing long-term fasting. You wouldn't be a candidate for doing vigorous physical work. You can get dehydrated. You can put undue pressure on the kidneys. You can do all kinds of damage if fasting isn't done properly and monitored properly. And so that means you're working with a physician to review your history, to do a physical exam, and to monitor your laboratory findings appropriately. And then, very importantly, fasting termination needs to be done properly. Too rapid a return to feeding after long-term fasting can result in refeeding syndrome, post-fasting edema, dehydration, all kinds of difficulties that are very real risk factors when things aren't done right. So again, if you're fasting at a facility, presumably those issues are all taken care of: history exam, lab monitoring, post-fasting recovery. If you're doing it at home in conjunction with your local doctor, or perhaps with coaches, like our doctors do provide some remote coaching to help physicians supervise fasting for patients that are doing it at home. The principles don't change, though. The need for rest support is exactly the same. You have to have a doctor that's willing to be supportive of you in doing that intervention. And in some cases, if people are at home, a modified version of this might be safer and better. Maybe you reduce caloric intake to 600 or 1,200 calories a day. You focus on fruits and vegetables, and you show some patience, because many of these things that we treat with long-term fasting can also be treated with healthy eating over time. The problem is it's hard to get people to make those diet and lifestyle changes when they feel terrible. And so sometimes the advantage of going inpatient and doing an intense period is just getting people feeling well enough that they're willing to eat well, rest well, exercise appropriately. And if they're patient, they can be successful. I have to tell you, a lot of people that we enroll in studies, because we're often booked a couple of months in advance, we have to work with them remotely before they can come in. Many of them get well before they ever come in because they've adopted the diet and lifestyle principles. True North Health is really good for people that they've done the diet and lifestyle, but for whatever reason, they're having difficulties. Maybe they're having trouble getting off medications. Maybe they're having problems despite their best efforts. That's fine. But for most people, most problems, diet, sleep, exercise diligently applied will result in progressive improvement and resolution of many of the problems that people suffer with.
But if someone is qualified by you, that they're a candidate to do a fast, and they get ideal coaching from you or your staff, would you at that point, for a typical person or an average person, say it's a good idea? What's the next thing? Would be a 1-day fast, 1 week fast? Like, what would you do?
It would again depend on their condition, just like it would if they were inpatient. And you don't know exactly what's ideal until you see how a person responds to that type of intervention. So they would be working with their local doctor. They would have had a history exam, laboratory testing. To the degree that we can be helpful, we can certainly provide them coaching in terms of advising them about symptoms that are common, come up during fasting, and work with their doctor if their local doctor doesn't have as much experience, perhaps in what kind of symptoms might show up in fasting. And if they're willing to rest and they're a good candidate, those results are good. We supervise a lot of, we provide a lot of support for people that are being supervised by their local doctors and doing fasting or modified fasting in home settings. It's a lot harder at home to get people to rest. It's a lot harder at home for them to control the variables. And that's why we like locking people up at True North Health, because we can control all those variables. And for people that are, again, on medications, have health complications, need to fast longer than 2 or 3 weeks, they're going to need to do that inpatient. For people that are relatively healthy, that have a cooperative doctor, they can often fast anywhere from 5 days to 2 or 3 weeks successfully in a home setting. But again, I have to tell you, the complications, the problems we see in home setting is higher than when they're inpatient, just because it's easy to make mistakes. It's easy to feed inappropriately. It's easy to be too active. It's easy to get dehydrated. It's also easy to panic about symptoms that may be perfectly normal adaptations to fasting, but that worry people, particularly maybe doctors don't have much experience with fasting because they're not used to seeing people get well. Most physicians never see people get well from conditions like hypertension or diabetes or autoimmune diseases. They tell them they'll be on drugs the rest of their life, that there is no getting well, because in their experience, they don't see people get well. Only a small percentage of medical doctors are lifestyle medicine doctors that have a fighting chance to get somebody well. Most people are pushing pills, potions, and powders and treatments that have nothing to do with ever getting anybody well. It's all about managing their symptoms with drugs.
And if someone did a 5-day to 2-week fast that was qualified under your supervision with a local doctor, is this something you do once a year, every 5 years, every 10 years? How often would you do it?
So again, it depends on the patient. For healthy people, we've actually published a study recently where we got those rare people that are metabolically healthy, fasted them, and take a look at what happens to people that are metabolically healthy that fast. And what was interesting is much improvement as you see in sick people in terms of blood pressure, blood lipids, and the rest. Healthy people that start off normal actually proportionally get even more improvement than people that are sick. The people that probably get the most benefit of fasting are the healthy people trying to use it preventatively to fine-tune their diet and lifestyle, their palate. And you'll see improvements towards health even in people that are within the, quote, normal ranges. And again, proportionally even more so than sick people. So I do think that a period of fasting, depending on the patient, from 5 to 10 days on a yearly basis is likely to prove healthful. We're going to be doing a long-term prospective study, actually looking at what happens to people that do a whole plant food SOS-free diet and fast for a week or so a year as a preventative measure, and what happens in the last 20 years of their life. What people are more interested than living longer is actually living better. Most of my patients know they're going to die, and how long they live is largely determined by genetics and luck. But how well they live in the time they have is determined by their diet and lifestyle. And if they'd like to not spend the last 20 years of their life unable to talk or move, lying in some nursing home bed waiting for somebody to come and change their diaper because they've had a stroke or heart attack, the best thing they can do is adopt diet, sleep, and exercise changes today. It's healthy life expectancy we're likely to have the biggest effect on, not just life expectancy.
Dr. Hashmi, do you recommend fasting of any type for people with chronic kidney disease, and what are the results if you do?
Yeah, so what we end up doing is that when we start to talk about the underlying conditions, so if we're dealing with diabetes, we're dealing with hypertension, we're dealing with obesity, those are where we find that there's a few things that are a big issue. So the first one is people's tendency to not have self-control. one of the beauties that you find with fasting that does really well. So, when you look at head-to-head trials, the misnomer for head-to-head trials is if you just look at calorie reduction and fasting, they'll say that there's no difference. Here's the dilemma with those studies is you're forgetting all of the secondary benefits that you're having to the gut microbiome, to your metabolism, to your ability to be able to create discipline. And this is one of the things that becomes so interesting. So, for example, when we deal with patients, as long as they're not insulin-dependent diabetics, we're not worried about their crashing, pregnant people, et cetera, after you get rid of all of those patients, what we focus on is we start with a very simple concept, which is we tell you, first, we need you to have a fixed sleep schedule. So, for example, if you're going to go to bed at 10 o'clock, and let's say you wake up at 6, the minimum we're asking for is 7 hours of sleep. This is really critical, and I talked about this before several times, is when you sleep less than 6 quality hours, your cravings for salt, sugar, and fat go up the next day. So that's why we recommend 7 hours, because people do end up having, for 7 hours, around 6 quality hours of sleep. That's number one. Number two is what we also know is the later you eat dinner, closer to your bedtime, the more likely you are to crave salt, sugar, and fat the next day. This is a fact, not opinion-based. There's many studies. You can go on PubMed and look at that data. So when we take people on this journey of fasting, we always start with this concept of working backwards from when they go to bed. Step one is fix their bedtime. Now, if you want to fix somebody's sleep, this sounds counterintuitive. The way that we do it is we always tell them is step number one is to wake up at the same time every day, 7 days a week. So do not sleep in on the weekends because it starts to mess with your metabolism and your circadian rhythm. And then we work backwards through it. So the concept here is don't take naps during the daytime. If you're going to wake up at 6, you do it 7 days a week. Now, if you can't fall asleep, so forth and so on, you still got to wake up at 6 because what we're doing is we're working on that rhythm backwards. Once we have that rhythm, then let's say you do go to bed at 10. We start with the idea of 4 hours before going to bed. We want you to focus on not eating anything. And that includes liquid calories. So it's really just water that you're going to have. And the concept there is when you look at your metabolism, on average, it takes about 4 hours to digest food. And so if you eat within that 4 hours before dinner, you're going to have food in your stomach. You're going to send blood to your stomach. As a result, you need that blood to go to all the other places that you really want. You want that deep, restful sleep. And that's where we use it, is because what we find is few things. It's great in terms of getting people on track so they can be successful in their weight loss journey in the long run. We're not doing a quick fix for them. What we're saying is these are things you can do from now till the day you die, and you can feel comfortable doing that. So intermittent fasting, sometimes people start to look at buzzwords like plant-based diet. These aren't buzzwords. If you understand what you're trying to achieve behind it, you can actually find that there's a lot of benefits. It's where people will take that concept, not fully understand it, and implement it without any supervision. That's where it becomes tricky. And that's our job, is to be understanding of what's the safety, who's the right candidate, how do you apply it, what does success mean? What are the metrics you're going to measure to say, is this working or is this not working? And in our weight loss patients, what we find is the concept of fasting is really helpful for discipline. One of the worst things that we've taught people is if you want to be healthy, just graze all day long. Keep eating more frequent meals. And they keep doing that. And every time you eat, you cause an insulin spike. The insulin spike goes down, crashes your blood sugar because you have insulin resistance. So now you ate something. 2 hours later, you're hypoglycemic. It's reactive hypoglycemia. And so as a result, your appetite shoots back up. So you get on this vicious roller coaster. And what we're trying to do is get you off of the roller coaster.
Our experience is very much the similar, that once people adopt an exclusively whole plant food diet with lots of vegetables, get rid of all the refined carbohydrates, a lot of the insulin effect is diminished, and the cravings, the binges, a lot of that stuff disappears. It's much easier to regulate dietary control in people who are not having their blood sugar levels bouncing all over the place.
You said that you recommend that we get up at the same time every morning, like 6 a.m. or 7 a.m. But there's a lot of people that are saying that sleep is very important and it impacts Alzheimer's prevention. So if you know you've had a rough night and you were up half the night and now it's 6 a.m., if you follow what you're saying, you'd get up at 6 and that would get you on a cycle. But on the other hand, you know you missed a whole bunch of hours and you'd rather sleep till 9 to try to catch up. So which should you do?
So this is where, the problem with nutrition and the problem with health is we always go to the extremes of concepts. And the extremes of concepts is what gets us into trouble every time. So to your point, Steve, when we take a step back and we look at sleep hygiene, what exactly is sleep hygiene? Is sleep hygiene that we come home, we're stressed out, we turn on the tube, we lay in bed, we watch it, or we're on our phone surfing the web uselessly, and now we wonder, why can't we fall asleep? And so to make up for that, we're saying that we shouldn't get up at the same time. But what I'm saying is quite the opposite. First, you have to create schedules in life. And this is the same thing, by the way, when we have patients trying to lose weight, is what we tell them is the more times you have to make decisions, the more likely you are to overeat, the more likely you are to make mistakes. So the idea behind getting up in the morning is also then you work backwards to make sure that, let's say your bedtime is 10 o'clock. Then starting at 8 o'clock, what are you doing? All electronics are off. What's your bedroom like? Do you have all sorts of bright lights in there? What do you do on the bed aside from sleep and sex? Do you do other stuff? And if you do, why? Do you read stuff? Do you watch TV? Let's minimize that. Let's make the bedroom the sort of sacred place where you do only two things. That's important. Next is what's your routine leading up to bed? Are you like, it's late, it's 2 a.m., let me just turn the lights off and fall asleep? Now, that may sound like a great idea, except for you're not training your body. At the end of the day, there's only two kinds of people. They're either trained or not trained. You can look at any Olympic athlete. They don't just go out there and compete in the Olympics. They spend a lifetime of training. When we talk about appetite, we talk about even diseases like diabetes, blood pressure, obesity. What we're talking about is helping people to build resilience, to build habits, and those habits translate. So it's not making an excuse. Oh gosh, some doctor on the internet said I got to wake up at 6. You don't need to wake up at 6. Let's say you wake up at 7. Let's say you wake up at 8 every day. I don't care. What I care about is that you make sleep a priority. And what it means to make a priority is you're waking up at the same time every day, building those habits and minimizing distractions so you can start to build that cycle. Lack of sleep happens because we have so many unresolved issues all throughout the day. We don't have those issues when we're trying to understand that there's a cycle we go through. A lot of people, when they toss and turn, if they think about the dreams they're having, oftentimes it's because there's all this stuff in their head that they haven't resolved through. And that's where schedules become so important. Whether you're into meditation, you're into religion, whatever your thing is, you're into yoga, you have to find what allows you to let go. Letting go is the hardest thing we have. What's fascinating is we can't change the past. We have no clue what's going to happen tomorrow, yet we obsess so much about yesterday and tomorrow that we forget the only thing we know is this moment right now, the present. And truly, that's, when people say this on movies and stuff, today is a present, it is. It's the gift that you and I are breathing. But you can't control tomorrow and you can't control yesterday. And those thoughts are going to drive you mad. But if you want to get better sleep, you need to work backwards. That's not the only way to do it. One way is to work backwards, work on sleep hygiene, work on schedules, get rid of stimulants. We talk about half-lives. And in medicine, half-lives is a very big thing gets thrown out. And so people say for caffeine's half-life is around 4 hours. Nobody cares about half-lives. What you should be asking is, what is the quarter life? Meaning, what's 2 half-lives? Because there are people who can drink coffee that are slow metabolizers, and they can drink coffee at 12 noon, and at 10 o'clock, they got plenty of caffeine in their system. So what we tell people is you want to, if you're somebody who's sensitive, you got to stop drinking caffeine before 10. There's all these little things that we do every single day that builds habits, and habits are a recipe for greatness. Greatness is not an accident, and greatness is not luck. It is doing the same thing every day when nobody's watching.
Thank you. Dr. Michael Greger highlights the risks of high sodium intake on mortality, advocating for reduced salt consumption to enhance longevity. In contrast, Dr. James Nicolatonio, author of The Salt Fix and The Mineral Fix, attributes improved exercise capacity and health not to low salt intake, but to balanced mineral consumption and reducing refined sugars. He argues that deficiencies in minerals like potassium and magnesium, coupled with high sugar intake, are the real culprits behind health issues often blamed on salt. Nicolatonio suggests that our natural inclination for salt, unlike the modern tendency towards refined sugar, indicates its essential role in our diet, potentially affecting our brain's reward system and sugar cravings. He emphasizes the importance of minerals, including magnesium, for overall health and performance. Given these perspectives, what does your research indicate about the relationship between salt intake in health and salt intake in kidney health? Both of you.
Well, just like you get all the essential fats you need eating a whole plant food diet, and you get all the carbohydrate you need eating a whole plant food diet. You don't have to add sugar to the diet. You don't have to add oil to the diet. You don't need to add salt. A high vegetable content diet has a gram of salt a day, and it gets your essential sodium needs met. Sodium is an essential nutrient without which you die. So I mean, we all acknowledge you have to get enough salt. The best place to do it, just like all our nutrients, is from whole plant foods. Excess salt in the diet, which is common because we have highly processed foods. Many foods, for example, bread, which people like with its 1,500 calories per gram, is full of salt, oil, and sugar. Oftentimes, if you take away the salt, oil, and sugar, we call it matzah, and it's punishment on Passover. So it's hardly the same food without the additions. Meat itself, boiled beef doesn't taste the same as meat when it's served with all kinds of sauces, gravies, etc. So salt, powerful appetite stimulant, leads to passive overeating. If you feed an animal, added salt, oil, and sugar, they get obese. They develop the same diseases we do. If you want people to lose weight, they need to also limit the salt intake, because they will, everything else being equal, eat more when there's a higher sodium concentration. People say because it tastes better. Well, of course it tastes better. That's what tasting better means, is resulting in more dopamine stimulation in the brain when the chemicals that you put in your mouth activate that brain response. So my concern with salt is passive overeating, increased propensity towards fluid retention, which leads to high blood pressure, all kinds of downstream problems with kidney function, etc. You need an essential amount of sodium. You get that from a whole plant food diet.
Thank you.
So, it's an interesting thing to put salt in the same sentence as potassium and magnesium and to immediately start saying that you need all these minerals and blah, blah, blah. If you look at the data, once again, not my opinion, we have very well-designed studies. You can PubMed them right now, and I'm happy to share all the links. What you'll find is you never want to rely on one study. That's the golden rule in medicine. You want to rely on several studies done by several different people coming to the same conclusion. And in medicine, we never say something is 100% accurate because we don't know. And this is what makes people mad is, how come you can't say that you're guaranteed to regrow your hair on your head if you eat a plant-based diet? Well, I don't know. I don't have a study for that. And I don't have 100% proof. My colleagues, that might have happened. I'm not that lucky. But when you talk about sodium, what's fascinating is if you look at potassium, if you look at magnesium, diets that are rich in magnesium and potassium, and in randomized studies, what you'll find is a few things. First, from an endothelial function perspective, the lining of your blood vessels contracts and expands better when you're on diets rich in potassium. Now, high potassium will kill you, low potassium will kill you. There's a sweet spot. But inside your cells, you have 20 times the concentration inside the blood. So if your cells break down, they release enough, you die like this. You get an arrhythmia, I can't get you out of the arrhythmia. That's called hyperkalemia. And you'll get into an arrhythmia, and it's very hard to get you out unless we know it's coming from potassium. Low potassium. Low potassium will cause rhabdo. Your muscles will break down. You will die. So low and high will kill you. But potassium is fascinating. A diet that's rich in potassium, which is, once again, by definition, a whole food plant-based diet, you'll find that your endothelial cells, they function better. You'll find that your blood pressure is lower. You'll find that the markers of inflammation are better. Switch to magnesium. Magnesium is amazing. There are so many incredible benefits. And yet, We don't talk about magnesium enough. It's very hard to get toxic on magnesium, but magnesium will improve the endothelial lining of your blood vessels, will improve your blood pressure, is actually protective of your kidney disease in a number of studies. Same thing with potassium. Potassium in studies shows that it protects against chronic kidney disease. In advanced kidney disease, potassium is not your friend. In advanced kidney disease, magnesium can become toxic. Now, for sodium, the data is very clear. Sodium will make the endothelial lining of your blood vessels worse. Sodium will increase the pressure inside your kidneys. It will increase intraglomerular hypertension. Sodium will cause you to spill more protein in the urine. Too little sodium, you die. Too much sodium, you die. Both of those things will cause seizure, coma, and death. So you need sodium. But to put sodium in the same sentence as potassium and magnesium, that's taking it a bit far in terms of those opinions. But the challenge there is, once again, everybody can claim to be an expert. And my job is never to say I'm an expert. My job is to look at studies and tell you, here are 50 studies that show you this. If you don't like me, that's okay. You don't like my hairstyle, that's okay. Read the studies yourself. Come to your own conclusion. But it is incredibly important that we shift the mindset from people being experts to people giving data. When you look at, for example, Dr. Greger's work, what you'll find is he's not out there saying a plant-based diet is great. He's there, here's all the studies I quoted. You don't like me? Okay. You don't like my beard? Okay. Go look at the data. So if we shift in the field of medicine from being opinion-based to being evidence-based, it gives us so much more credibility, and it allows us to step away from this concept of that doctors are perfect or somehow you're a PhD, you're perfect. Nobody cares. What they care is my loved one is going to die. Can you help me? I'm vulnerable. I'm coming to you for trust. Can you help me? And that should be our ultimate goal.
If you look at a condition like high blood pressure, which is one of the leading contributing causes of death and disability, and look at the data of the experience at the True North Health Center, we have retrospective data, 174 consecutive patients with hypertension, 174 people lower their pressure enough to eliminate medication. We've got prospective studies now with up to 1 year follow-up data showing that 28 out of 29 people can normalize their blood pressure. A year later, they're still without their weight recurring, and they're still able to maintain blood pressure. And we're doing it on whole plant food, SOS-free diets. We'd love to see the people that are doing high sodium diets and that are getting those kinds of results and maintaining long-term outcomes in chronic degenerative disease. I don't see the data. So show me the data. I mean, no question, like John McDougall says, everybody loves good news about their bad habits. Everybody would love to be able to eat sugar, salt, oil, chocolate, cheesecake, whatever, go on the dead Dr. Atkins diet, may his filet of soul rest in peace. But, that's not what my experience is, and it's certainly not my understanding of what I've read in the literature. I think we've got to just stop kidding ourselves.
If I asked you how many cigarettes you're going to smoke this year, I assume that both of you would say 0. So that means you're really clear that cigarettes is a non-negotiable hard no. But if I said how much salt are you going to have this year, and that means salts that are on olives, salt that's in your guacamole, salt that's in flat crackers, when you say no salt, how serious are you? I know with cigarettes you mean 0. With salt, what degree should we interpret this when you say avoid salt?
So I'm never going to be eating more than 1,000 milligrams of sodium a day because I eat my food at the True North Health Center, where we use whole plant foods. So it's fruits, vegetables, grains, legumes, nuts, and seeds. There is no added salt. So I know that I'm not going to have any problems there. I'm not going to have any problems at home, where sometimes you can get into trouble, even when you're being super diligent, is avoiding food if you're eating other people's food, because other people are going to try to poison you whenever they get a half a chance. So salt contamination happens. If you eat any kind of processed foods, you're going to be getting some contaminated salt. And, the fact is there is some capacity in healthy individuals for sodium variation. But the goal is to not use any added salt. Eat the salt that's inherent in the whole plant foods that you're eating, hopefully every meal of every day.
Okay. There was a book that came out by a woman named Sally Norton called Toxic Superfoods, and she made the following points. She said that she herself had health issues arising from a diet low in animal fats and high in vegetables. And she said there's a significant yet often overlooked problem of oxalate toxicity, which can subtly deteriorate health over time. She identifies common foods like potatoes, peanuts, and chocolate as major sources of dietary oxalates. Norton explains the concept of bioaccumulation, where oxalates build up in body tissues over time, leading to health issues when high oxalate foods are discontinued. Norton oxalates disrupt cellular function by interfering with essential minerals like calcium and magnesium, impacting cellular communication and overall health. The well-known link between oxalates and kidney stones is emphasized. Norton emphasized the importance of a balanced diet while being cautious of oxalate content. Based on the principles of reducing oxalate intake, the following foods are generally considered safer options. Low oxalate vegetables such as lettuce, cucumbers, and mushrooms, meats and poultry, beef, chicken, and other meats are naturally free of oxalates. Dairy products, milk, cheese, and other dairy products which provide calcium that can help bind oxalates in the gut. Eggs, a versatile protein source without oxalate. Fruits, certain fruits like apples, bananas, and melons tend to have lower oxalate levels. Norton's approach is not about completely avoiding all oxalates, but rather being mindful of high oxalate foods and their potential impact on health. The following foods that are high in oxalates: high oxalate vegetables, spinach, Swiss chard, and beet greens, nuts and seeds, especially almonds, peanuts, and chia seeds, which are known to be high in oxalates. Tubers, sweet potatoes, and potatoes, which can have significant oxalate content. Legumes, including soy products and beans, which are often high in oxalates. Grains, particularly wheat bran, and other whole grains that might contain higher oxalate levels. Fruits, certain fruits like blackberries, blueberries, and kiwis, known for their higher oxalate content. Chocolate, dark chocolate, and cocoa are particularly high in oxalates. Should we stop eating high oxalate foods? Are we at risk of getting kidney stones from too many high oxalate foods? Should we soak our beans in whole grains to help with us? Please guide us on this, both of you.
Okay, so let's take kidney stones since this is really interesting. Did you know what the first treatment for calcium oxalate stones is? And all the audience that's listening in today, put it in the chat. I'd love to know what you think the treatment for calcium oxalate stones is. It turns out that the treatment is simply drinking more water. How much water? We ask our patients to make 2 liters of urine a day. And it's very simple. Is because when you think about how stones form, stones is debris that sticks together, and that's how it collects and it forms a stone. In a stream, if you're ever in the forest, drink from a stream. Well, in a pond, meaning urine sitting around, debris can collect. That's number one. Number two is it's not the oxalate that's the issue. It's the lack of calcium in the foods that you're eating, because the calcium in the foods will actually bind to the oxalate inside your gut and you poop it out. The oxalate never enters your body. As far as oxalate poisoning is concerned and is going in the tissues, when we talk about quote unquote poisonings and tissue deposition, we have so many animal studies where they've actually looked at tissue samples to look at what's in there. So animal studies are abundant in humans too. Now, I've been doing nephrology for over 2 decades, and I can tell you, with oxalates, yes, we talk about reducing the oxalates, but we don't tell you to throw the baby out with the bathwater. In other words, the reason this matters is because the foods that you're mentioning, if you talk about things like what is the longest living people on the planet eating, let's take that as a study and look at all of the studies that have been done looking at them. Their diet is predominantly a whole food, not a plant-based diet, quote unquote. It's a whole food plant-based diet, right? They're already doing that part. Number two is this is where fear-mongering can go on to a whole other level. And the problem is any one of us can become an expert and start to say, well, I think you should do X, Y, and Z. This goes back to the same point that it's not one study. I saw a comment in the chat from Julie Hemmings who said the data can be interpreted in different ways. Julie, and I would answer that question by saying, this is why we don't rely on one study. This is why we look at what are the conflicts of interest? Where was the study published? How large is the population? Where else was it replicated? Was it completely different people? How many times has it been replicated? And those are all that are going to strengthen the evidence. So I would caution on a lot of these comments because of the fact that what we want to see is we want to see the data. We know that we have the ability to do tissue biopsies, and we can get the data on quote unquote oxalate deposition in the organs. We can reduce oxalates in the diet, but more importantly, a diet that's rich in whole foods. The calcium will actually bind to the oxalates in the gut, which will prevent the absorption in the first place. And so there's all this stuff that's important in physiology to understand. And that's why it's easier for me to say stuff that sounds exciting and people will be attracted to that and you get more followers. It's a lot more boring to say stuff that no, we may not have the data. It's not as exciting. And I get that.
Having lived with thousands of patients over the years and fed them and controlled their environment, I can tell you that although there are definitely people that have food sensitivity, sometimes it could be oxalates, sometimes it could be lectins. There are people that have all kinds of allergies and sensitivities. Overall, the issue is the diet is an integrity as a whole, and people that adopt whole plant food diets and start doing basic things like hydrating adequately, most of this stuff goes away. It's a very rare exception that you're having to get into very specific dietary manipulations where you have to identify whole classes of whole foods in terms of dietary regulation. It's an exception, not the rule.
Thank you. According to Michael Greger's research, consumption of nuts is associated with reduced risk of premature death, making them an essential component of a diet aimed at promoting longevity. Dr. Greger highlights walnuts in particular for their omega-3 content and potential in improving artery function. Do you agree, and what are the health effects of a diet high in plant fats like raw seeds, raw nuts, avocados, and olives? What are the pros and cons? There are some people that are suggesting a lot of this, and others that are suggesting that we try to avoid fats because they're saying it's a cause of high blood sugar. So what is your thoughts on?
So, you can certainly overdo anything, and overdoing nuts and seeds is easy to do because they're very concentrated foods. So it is one of the foods that we regulate quantity. We suggest people limit their, in general, consumption of nuts and seeds to an ounce a day because we're looking for around 15 to 18% of calories coming from fat for most people and around 10% of calories from protein. And so although we might regulate how much of that we recommend, we certainly include nuts and seeds for the vast majority of people. They are excellent sources of concentrated nutrition. It's just a little bit easier to overdo them. One thing that's great suggestion I find is to make people use nuts and seeds in the shell. By the time you shell 6 walnuts and eat them, you want to move on with your life because it takes a lot more time than it does to be eating nut butters and other things like that. So sometimes it's just a question of quantity. And again, are there people that have nut sensitivity? Sure. There are people that, if they eat one, they can't stop and they have eating related issues. And so they may have to modify their diets to accommodate their particularities. But for most people, nuts and seeds can be a very beneficial part of the diet. However, the reductionist claims that it's the nuts and seeds that are making people live longer is a mistake. I suggest people read T. Colin Campbell's book, Whole. It's the diet as a whole that seems to be the most important variable, not the specific isolated products within it. And this incessant attempt to look for superfoods, instead of understanding it's the diet as a whole that is where the power lies, not necessarily the individual components isolated or contracted. I think that's better advice.
Thank you.
And then from a kidney perspective, the only thing that we're worried about in terms of fats is just the saturated fats. That's where we have the correlation where higher intakes of saturated fat is linked to higher protein in the urine. So if you already have protein in the urine, you're more likely to have more of it if you start to increase it. And then in terms of nuts, in terms of one being better than the other, that I don't have any data to be able to say that there's such thing as a super nut, which is kind of funny in itself. But all we end up saying is that if you're going to have nuts, they are overall healthy. Just be careful of the ones that you get packaged. It's a funny thing what Dr. Goldhamer said in terms of having to peel it yourself. I'm going to use that with my patients. I think that's brilliant Because the analogy I give them is like, don't keep bad food in the home, because if it's in the home, it's in your mouth.
Also, they're fresher, and there's a lot of advantages to using whole nuts, but the biggest one is you just can't overeat as easily.
And you know that my worry on the packaged ones is oftentimes like they got all this stuff added, they got a ton of salt added. And I tell you, there's this thing, people crave salt, sugar, and fat. We were biologically designed that way to crave it from just a survival perspective.
Right.
And we figured out how to manipulate the heck out of it. But this is why French fries are so evil. I hate to say it, but I have more patients who struggle with French fries than anything else. Because if you think about it, it's fat, it's, salt, and it's sugar, and it's the perfect mix all there. And that's why this whole concept of, trying to get rid of these things are really, really hard. If you give them all three at once, all the dopamine in your head lights up.
We wrote a whole book about it. It's called The Pleasure Trap, the hidden force that undermines health and happiness. And I just tell patients, instead of eating those French fries, just find the deep fryer, stick your head in and suck, because that's what you're doing.
If anyone would like to ask a question, please go to the reaction tab and click the raise hands. In your years of working with patients, have you found any relationship between fasting and cancer? Does people who have cancer and go on long-term water fast benefit?
Well, I can tell you that we've published, initially we published a case report in the British Medical Journal on the treatment of follicular lymphoma with fasting and followed by a whole plant food diet. And we did a 3-year follow-up, and now we've got a 10-year follow-up where the patient continues to be cancer-free. Since then, we've been tracking a number of patients with lymphoma. We have a case series that's now been accepted for publication. It'll be coming out in the next month or two. And we've been seeing consistent responses to lymphoma to water-only fasting and sustaining and improving improvements with a whole plant food SOS-free diet. So we believe that we now have enough data that we can justify a clinical trial, and we'll find out what the literature will say.
And I understand you only want to say accurate things, but if you had an answer based on your gut feeling, if you did a long-term study on people with cancer who did a long-term water fast supervised, followed by the ideal diet and as much fasting as you thought was appropriate, what do you think the results would be?
Well, in the case of lymphoma, we were confident that the results are going to be quite impressive. And particularly when you consider that there is no medical treatment that affects all-cause mortality, it's not considered unethical for us to, get people well. If you're treating solid organ tumors, you're not going to have the same results. We really do know what the cure for cancer is now. It's called prevention. So if you really want to think about a cure, you got to think about prevention. Otherwise, you're talking about management. And that's true for everything. High blood pressure, diabetes, kidney disease, there's no cure. You can sometimes lose the weight and keep it off for the rest of your life. But if you go back to eating greasy, fatty, slimy, dead, decaying flesh processed foods, you're going to get fat again. And if you normalize your blood pressure, you can keep it down with a good diet. You go back to the old diet, your blood pressure is coming back. And, so there are some conditions that are more responsive than others. There's not been a lot of literature published on solid organ tumors effect with fasting because it's considered unethical to interfere with standard of medical practice. So it's going to be a little bit more tricky. We're fortunate with lymphoma that the medical management was ineffective enough that it was considered acceptable so you can actually publish your outcome data.
Thank you. Cheryl, would you like to ask a question, and where are you from?
I'm from California. Hello, doctors. You're awesome. And back on the oxalates issue, if I have 0 health problems, I have never had a kidney stone, may I safely eat all kinds of high oxalate dark leafy greens like spinach, Swiss chard, kale, beet greens with reckless abandon?
Well, I would certainly say yes.
Yeah, so just keep in mind that as you start to do this stuff, remember there is enough stuff in your body right now as you and I are talking to kill you instantly. And it's a modern day miracle to understand that why are we still standing here and not dead? You know, when we talk about electrolytes, and this is why it's so crazy and so important to understand, our kidneys do such a remarkable job. Our hormones in our body, like insulin, that are shuttling things in and out of cells all the time, our breathing that changes the acid-base physiology that allows things to move back and forth. So when we talk about things like oxalates, remember, your kidneys are this beautiful cleaning mechanism. Just like your liver filters the blood as a first pass, you talk about kidneys, and that's all they ever do. And so when you think about how much abuse we put them through, it's quite remarkable. And this is the miracle of life. You know, just the fact that we are as advanced of a species as we are, and we're standing here, it's nothing short of miraculous. So from that perspective, go to town, eat a whole lots of fruits and vegetables, and if you end up avoiding the other stuff as a result of it, meaning you're not having the McDonald's French fries and all that stuff, then more power to you that you have made a really good decision. And just remember, you know, we're all going to die. And at the end of the thing, that when our time comes, people are going to care how we lived. And this is where you have this amazing opportunity to not only eat more fruits and vegetables, but the act of eating more fruits and vegetables makes our entire planet sustainable, makes it so that our kids see by example. Kids do not listen to what we say, they listen to what we do. So if you're eating more fruits and vegetables, your kids are more likely to eat more fruits and vegetables. So yeah, absolutely.
Dr. Hashmi, just to make sure that we got this perfectly clear, for all of us who are saying, I want to do whatever I have to do to avoid ever having kidney stones, what exactly are you saying we should do to make sure we never have kidney stones?
So first, remember, there's acidic type of kidney stones, there's alkaline type of kidney stones. So you need to understand which type of stone you have, because after the first step, the recommendation is different. Okay. So the first step recommendation is you got to make 2 liters of urine a day. If you have a kidney stone, we need you to be peeing all the time. So what do? We tell our patients that you need to drink 2 to 3 liters of water per day. Here's the catch. You're not supposed to drink it all at once. So it's not like you're drinking 2 liters of water in the morning and then you're done for the day. But the point is you're drinking it throughout the day, because what you're doing is making the urine flow through. There's a condition that we talk about where we talk about a disease called polycystic kidney disease. You start to form all of these cysts. One of the medications that's a treatment for it, called tolvaptan, what it does is it basically blocks the channel inside your kidneys that holds on to water. As a result, you have this massive urine. In fact, if you're not drinking a minimum of 2 to 3 liters of water a day, we can't even put you on the drug because you'll get dehydrated. So what it does is, by having that flow, it actually helps the cysts to not grow. And in some cases, they may actually shrink a little bit. So water is the #1 treatment when we talk about kidney stones. #2 is if you have the acidic type of kidney stones, we talk about citrate or an alkaline diet. An alkaline diet, by its very definition, is a plant-based diet. So what do? We add lemons and limes to every, like whatever water you're drinking. We're going to add a tons of lemons and tons of limes. How much? 2 to 3 tablespoons, 2 to 3 times a day, sometimes 4 times a day. If that's not enough, and we do a 24-hour urine collection, we look at all those markers. We look at how much salt you're spilling, because salt is going to cause kidney stones. We look at how much calcium there is, because that's going to cause kidney stones. We look at how much oxalate. So we do this 24-hour, what we call a kidney stone panel. Based on that, we make the dietary recommendations. And if we know it's an acidic type stone, because as you know, calcium oxalate is acidic, and it's the most common type of stone there is. If we know that, we're going to use lemons and limes with all the water. If it's an alkaline type stones, then we're not trying to alkalinize the urine more. We actually try to acidify the urine. So whatever type of stone it is, we want to create the opposite environment. But rule #1, you got to drink water, and not all at once. You're trying to drink it all day long because you're trying to create a river, not a stream. In general, minimize the sugar, minimize the salt. Those are always going to be key as far as that goes. And get a 24-hour kidney stone panel done so we can know exactly what we're treating.
And in terms of prevention, remember that obviously drinking water is a simple way of hydrating the body. The other thing is a diet very high in fruits and vegetables is very high in water. And so you'll make a lot of urine in addition to the water you're drinking, just from the diet that you're eating, and not eating a diet that's full of salt and other things that cause kidney stones. In fact, in my experience, it's extremely rare for people eating whole plant food diets to be forming stones. And people that have had a history of forming stones generally stop having as much problem when they adopt these dietary principles. So it's actually the rare person that's on a healthy diet that's actually forming new stones.
Patrick, would you like to ask a question, and where are you from? I can't unmute you. Mute you, Patrick. Oh, yeah, go ahead.
I got it. Thank you, Steve. Yes, hi, New York. Sean, you had mentioned lemons and limes in the water. Is there an alternative that you use for people with citrus allergies?
Steve, could you repeat that for me? I missed the last
Patrick,
part.
say that again, please.
Sorry, I'm sorry if I'm not coming through clear. Let me just pull this microphone a little closer. Is that better?
Okay.
All right. So you had mentioned, Sean, using lemons and limes to change the pH of the water. Is there an alternative that you use for people who have citrus allergies?
Yeah, so remember, we can always give you potassium citrate, but generally speaking, a plant-based diet is an alkaline type diet to begin with. So the less acidic foods, meaning meats that you're having in your diet, the more alkaline you already are. The first and most important treatment is just water, not alkaline water. It's just water, because debris can't stick around and can't collect to form stones in the first place. So if you're drinking a lot of water, that is the most important thing. And if you have any issues with citrus related stuff, remember, the only reason that we don't talk about things like oranges or orange juice, because we don't like juices to begin with, but oranges, is because of the fact that there's so much vitamin C, and vitamin C will convert to oxalate. And that's why we don't go for oranges, we go for lemons and limes. And if you have a citrus allergy, we can always give you potassium citrate or potassium bicarbonate if we need to.
Yeah, bicarbonate. Just for on a point there, I'm not sure if you're aware of this or not, but a lot of people with citrus allergies react to the citrate.
So
the citrate form of supplements. If you have a citrus allergy, you will react to those.
Understood. But I don't think that's as accurate, because when we do give people potassium bicarbonate, citrate converts to bicarbonate. So you can give bicarbonate directly, or you can give citrate directly, and it will convert to bicarbonate. And at the end of the day, that is not the main form of treatment. The main form of treatment is still fluids, fluids, and fluids.
Okay, so to wrap up, Dr. Hashmi, how can people follow up with you, stay in touch with you, go to your website? How do they follow your work?
My website is selfprinciple.org. My YouTube channel is youtube.com/selfprinciple. You can go over there, and every week we have a live session on Fridays from 5 o'clock to 5:30, where we actually go through some new topic. And you can see on the screen right now, we just covered magnesium. We also have AMA sessions once a month, where you get to ask me anything on any topics you might have. But essentially, that's there, and it's a public service. So if you find it useful, you're welcome to go and do it.
Thank you very much. And Dr. Goldhamer, for people that are interested in following up with you and your work, how do they get in touch with you? What are their options?
They go to our website at truenorthhealth.com and complete the registration forms. I offer a no-cost phone conversation to try to point them in the right direction. We do have an active telemedicine practice. We have our inpatient facility, a lot of books. All of our content is freely available. It's just go to truenorthhealth.com.
Okay, well, thank you both for all your great work. And if we could unmute the audience so we could thank our speakers.
Thank you.
Thank you very much.
Thank you both for your teaching.
Thank you.
High question for yourself.